Just days before the Thanksgiving holiday, coronavirus cases and hospitalizations are on the rise here in San Diego, and we're not the only place where that's happening. But new numbers that just came into the newsroom show 1,546 new cases of COVID-19 here in San Diego County today. That is a new single-day record. It's also a 9% positive rate of the tests taken. 16 new deaths were also reported, bringing the county's total now to 984. And right now, 518 people are hospitalized with the virus, including 151 who are in the ICU, and 15 new community outbreaks were reported today. Some pretty daunting numbers there. With that in mind, San Diego County Supervisor Nathan Fletcher joins us now with the latest on what's going on. Supervisor Fletcher, you hear those numbers. What do you make of what we're seeing out there today?
Well, it's very concerning. It's not just the number of cases. I mean, it was just a few weeks ago, Andrew, we were at 200 to 300 cases per day. Now we've had multiple days over 1,500 cases, but it's also the impact on the healthcare system. We've had a more than doubling of our hospitalization, and we know that that will get worse because there is a lag between cases and hospitalization, and the percentage of positive is up as well. And so all of these should be ringing the alarm bell for each and every one of us, that every San Diegan has to make the individual and independent decision that we are going to focus our efforts around slowing the spread. And that will not only save lives, that will help ensure we can start the new year in a better position and get our businesses back open. But it really is imperative. I know folks are tired. I know there's a sense of fatigue, but we've got to come together as a community. We've got to fight this thing back one more time. And then hopefully next year, we'll be in vaccine distribution mode. We'll begin to see the light at the end of the tunnel, but we got to get in the fight and we got to stay in it for a little bit.
Yeah, hopefully the vaccine's right around the corner, but still, as you said, we're not quite there yet. Right. Looking at these numbers, you'd understand if we saw record numbers given the testing. Everybody's kind of getting tested right now, in part because of the holidays. They might want to kind of have that peace of mind, but the percentage of the positives is really notable. The number of hospitalizations is notable. The number of deaths is notable. At what point is it, hey, everybody do the right thing, versus we need to restrict you further, like we're seeing to our north in LA County?
Well, the great hope is we don't have to do that. None of us who have the burden of the public health crisis and have to take action daily to protect people and to save lives and ensure the economic situation doesn't get worse. None of us want to do that. And that is why we're really hoping. We're really hoping the awareness, the heightened sense of what's happening. And, you know, Andrew, there's a great debate as we head into the holidays that you know, this Thanksgiving will be different. We're not saying every Thanksgiving. Next year we think we'll be back to normal, but this one Thanksgiving, we need to adapt and celebrate with our households and avoid those gatherings. But we also have to be reminded that there's 984 San Diego families that aren't going to celebrate Thanksgiving with their family, not because they're choosing to be careful, but because their family members are dead. And that is a stark reminder of what is at stake here. And so our hope is we don't want any more restrictions. Let's come together as a community. Let's slow this spread. Let's get these numbers down. And then let's come out with a new year, hopefully with the vaccine, and let's work our way out of this. But we really have to act, and we have to act now.
Yeah, it's easy for a lot of people to kind of look at what's going on out there and kind of say, well, it's not me, it's not my family, it's not my community per se, and say, you know, maybe these numbers they're just numbers. We're getting a lot of tests out there, and it's not necessarily affecting us. And why should my business, for example, be shut down? What do you have to say to those businesses out there who are maybe not complying with this new purple tier, and they just want to stay in business? I mean, there's so many people out there that are saying, okay, we know that there's numbers, but I got to keep my family, you know, with food on the table as well.
Well, my heart hurts for those folks. Look, it's no fault of their own. You're a gym, you're a restaurant. Never did we ever imagine a global pandemic that would cause people to have to close their indoor operations. Now, we know, Andrew, that if we don't take the steps we're taking and it gets out of control, we know the economic damage would be far greater and would impact far more. But that doesn't help those folks. And that's why Supervisor Greg Cox and I have called an emergency meeting in the Board of Supervisors tomorrow afternoon. We're proposing $20 million of county general fund revenue to be made available to help our restaurants and our gyms who have been impacted by the purple tier, just to bridge them through the holidays, give them a little help and assistance in hopes that we have another federal stimulus. And I know none of these businesses want handouts or grants. They just want to be in business. But the reality is it's COVID that has caused this problem. And until we get through this, there is no thriving economy. There is no successful indoor operations in high risk settings. And so we want to try and help bridge that gap. We're counting on the federal government to come through in January with an additional one. And then we're looking forward to a vaccine, and we're looking forward to our way out of this and everyone getting back to life as normal. But until then, we don't have a choice. You're picking the less bad option. And right now, the less bad option is to restrict the highest risk indoor settings that we know are most likely to cause super spreading events that would set our entire economy back.
Help us understand this proposal that you and Supervisor Cox have put together. It's $20 million. It's going to be considered tomorrow. Do you expect this to pass? If so, how many businesses do you think it will help? And will $20 million be enough to really make a difference?
Well, $20 million won't be enough to solve the totality of the problem, but it is a positive step forward, and it is something that, as a county government, we feel like we should do, and we should do it to help businesses in every jurisdiction. Individual cities may choose to come in and do something similar, but it is intended and aimed to help just bridge through the next couple months. It could be someone's mortgage, it could be their rent, it could maybe help them move outdoors a little bit more. But we're trying to do everything we can in this difficult situation to give people a little bit of help and assistance as we get through this. And so we're going to consider it tomorrow. I've been in politics a while. Sometimes things you think are no-brainers turn controversial. I can't imagine this would be. I can't imagine anyone would be opposed to us doing what we can to try and help those that are being impacted hardest from the economic situation tied to the public health orders.
Hopefully it makes a difference for a lot of folks out there. Lastly, Supervisor, I want to ask you about the hospitals. So we've seen these numbers go up and up. Are we prepared if this number continues to increase at the pace it's going right now?
Well, I was on a lengthy call with the CEOs of all the hospital systems, getting a situation update from them and what they're seeing. And the concern is not so much what we face today. There is a historic kind of lag in hospitalizations around Thanksgiving. A lot of doctors don't schedule procedures during this time because they're off. And so we have a little bit more bed capacity than we would. The concern is really in 2 weeks, as we see the hospitalizations tied to the significant jump in cases, as we see them begin to get back to some of their numbers. And so we're talking to them daily. We're monitoring the statistics daily. We do have some capacity to surge in terms of beds, but the real challenge before us is staffing. For a hospital to work, you got to have the stuff, the structure, and the staff. And there is a critical shortage of nurses across the world right now. And so we're working to do everything we can to prepare for an increase in hospitalizations and try and mitigate it as best as possible to get us through this.
All right, everybody's got to do their part, especially during Thanksgiving, to do the smart things, keep a distance and wear a mask and do everything we need to do, keep ourselves healthy so we can keep each other healthy. Supervisor Fletcher, thank you for your time and your insight as always.